Assalamualaikum and a very good day to the judges and audience. I am Ridwana binti Sait from University Putra Malaysia and I will be presenting my research titled Factors Associated with Energy and Protein Intake Among Breast Cancer Patients in National Cancer Institute. Let us embark on this journey of knowledge together. This will be my content of presentation. I will start off by giving you an overview of breast cancer. So what is breast cancer? According to the Centers for Disease Controls and Prevention, breast cancer is a condition in which the cells of the breast grow uncontrollably. Breast cancer may start in any area of the breast. Breast cancer is a growing global burden affecting millions of women worldwide. Even here in Malaysia, the graph indicates that the breast cancer was the most prevalent type of cancer, with having 19% prevalence in year 2012 to 2016 according to the National Cancer Registry report. Besides, statistics show that 1 in 19 Malaysian women may develop breast cancer in her lifetime. While treatment methods have advanced, it is important to recognize the significant impact that nutrition plays in the recovery and overall well-being of breast cancer patients. When we talk about nutrition in cancer patients, energy and protein intake take center stage as fundamental components, as inadequate energy and protein intake could lead to further health consequences such as malnutrition. Women with breast cancer are at risk for malnutrition in addition to having problems with their quality of life and being physically active. Malnutrition in cancer patients may come from increased protein and energy needs, as well as reduced intake brought on by the tumor itself, as well as treatment-related adverse effects. So, as a dietitian, we rely on current evidence-based guidelines to determine the nutritional requirements for cancer patients. In fact, the ASPEN Clinical Nutrition Guidelines 2021 recommend an energy intake ranging between 25 and 30 calories per kilogram body weight per day, with protein intake exceeding 1 gram per kilogram body weight per day, and if possible, up to 1.5 gram per kilogram body weight per day. Malnutrition was present in between 43.5% and 61.9% of cancer patients evaluated for their nutritional condition at the National Cancer Institute of Malaysia, according to previous research. Malnutrition can influence treatment outcomes, delays wound healing, worsen muscle function, and increase the risk of post-operative complications. Unfortunately, majority of cancer patients in Malaysia do not meet their energy and protein needs according to previous research. Similarly, a study conducted by de Kreef et al. In 2021 also reported that the energy and protein intake of breast cancer patients found to be inadequate. However, while various studies have been conducted in other countries examining this relationship, there has been a lack of research focused on the Malaysian population. Existing local studies only focus on malnutrition and not the energy and protein intake adequacy. Further research on this topic could help to identify the factors affecting adequacy of energy and protein intake among breast cancer patients in Malaysia. Besides, there were inconsistent findings on factors influencing energy and protein intake, with local studies being scarce. With this in mind, the objective of my study was to investigate the factors associated with protein and energy intake among breast cancer patients. Moving on, let us turn to the methodology part. To investigate the factors, I conducted a cross-sectional study in Oncology Clinic National Cancer Institute in Putrajaya. The inclusion criteria were all female breast cancer outpatients, aged 18 years old and above, Malaysian and able to communicate verbally, while the exclusion criteria were complicated with chronic disease and fluid retention, and participants in other research study. About 234 sample size was obtained from the calculation with an additional of 20% respondents. I opt for purposive sampling as my sampling approach, enabling me to gather insights from the most suitable participants. Specifically, I focus on breast cancer patients within National Cancer Institute, selecting those who met all the necessary criteria to participate in this study. Moving on, I have divided my research instrument into 5 main sections. Firstly is the socio-demographic background by using self-administered questionnaire. Next is the anthropometry data, where I obtained through self-administered questionnaire or medical record. Thirdly is the medical characteristics, where I obtained the data from self-administered questionnaire as well. Next is the hand grip strength, where I use a hand dynamometer as a tool, and this is the cut-off points according to Chen et al. 2020. Lastly is the food history. Energy intake and protein intake were obtained from food frequency questionnaire and calculated using Nutritionist Pro software. I categorized the findings as inadequate and adequate. Next, ethical approval of this research was obtained from the Medical Research and Ethics Community, Ministry of Health Malaysia, and a temporary pass application was granted from the Clinical Research Centre of the National Cancer Institute, Putrajaya. The data was collected from April 2023 until May 2023. All data were analysed by using IBM SPSS Statistics version 27. Descriptive data was analysed through univariate analysis, and the result for categorical variables was presented in frequencies and percentage. Chi-square test was used to test the association between categorical variables. Let us now look at the next slide, which shows the results and discussion of my findings. Due to time constraint and lack of manpower, this study involved 32 breast cancer patients, and majority of them were Malay, married, achieved secondary educational level, unemployed, and in B40 classification. Next, from figure 1, we can see that the majority of participants fall in category of overweight. This finding aligns with previous studies demonstrating a high occurrence of overweight and obesity among individuals with breast cancer. Many breast cancer patients experience weight gain, often due to factors such as reduced physical activity, increased appetite during treatment, thus lead to higher energy intake. This finding emphasized the importance of closely monitoring weight changes and design an intervention. Among the 32 participants, from figure 2, we can see that in terms of cancer stage, the majority of participants were at stage 3, followed by stage 2, stage 4, and stage 1. Next is the hand grip strength. It was found that 71.9% of participants had low hand grip strength, falling below the threshold of 18 kg per force. This shows a striking observation which may be due to clinical symptoms and damaging effects of cancer treatment. Now, I'd like to stress the following points. As you can see on the pie chart figure 4 and figure 5, the majority of respondents achieve adequate energy and protein intake, contrasting the findings from previous studies. The differences may be due to underreporting. Study populations such as hospitalized cancer patients are more likely to experience malnutrition compared to outpatients, or the instrument used for dietary recall. The findings of my study revealed some intriguing insights. Although no significant association was found between socio-demographic background, anthropometry data, medical characteristics, and hand grip strength with protein intake, my study did reveal that age and body mass index have a significant association with energy intake. Age, as we all know, brings with it physiological problems and changes that influence energy intake. In this study, we observed no significant association between socio-demographic characteristics with protein consumption among the participants. However, these findings contrast with the research conducted by Campos et al. In 2018, where they found a notable link between higher socioeconomic status and increased protein intake. This connection was attributed to individuals with greater economic means having the purchasing power to access a more diverse selection of food options. Next, the test did reveal a significant association between body mass index and energy intake. Participants with abnormal BMI values, categorized as overweight and obese, tend to exhibit more sufficient energy intake compared to those with normal BMI values. And this aligns with the findings of a study by Alkan et al. In 2018, where lower BMI corresponds to reduced energy intake, and higher BMI is linked to weight gain, often attributed to lowered physical activity and increased energy consumption during treatment. Unfortunately, there is no significant association found between medical characteristics with energy intake, which is in contrast with findings from previous study, where there is a significant association with chemotherapy treatment and energy intake due to the chemotherapy-related side effects such as oral mucositis and dry mouth, which can disrupt the nutritional intake and impair the immune response. Lack of significant association may be due to several factors, including the size of the sample, characteristics of the population, and variation in measurement techniques. In conclusion, most respondents had adequate energy and protein intake. Diet intervention should be emphasized to prevent further health complications due to high prevalence of overweight among breast cancer patients. It is also important to consider age-related factors when developing interventions to optimize energy intake among older breast cancer patients. The findings of this study highlight the importance of addressing specific factors that may influence energy and protein intake. Hence, it provides important key ideas on how to plan an effective intervention. Further research to expand this study should include multiple centers and larger sample sizes, and consider including additional factors to obtain a more comprehensive understanding of the determinants of energy and protein intake adequacy. Here are my references. With that, thank you for listening.